All right. Good afternoon, everyone. And I'm joined here today, Dr. Alexander Scott, Stephen Pryor with Commerce, and Tom McCarthy, Executive Director of the state's COVID response. So we have some positive updates today to share and continued challenges this year. So I'd like to start by giving an update on the Rhode Island's vaccine distribution rating from Harvard University. Getting shots into people's arms quickly and building out Rhode Island's vaccination capacity has been one of our top priorities. And we've been focused on this not only for the last 23 days, but also during the time that I was incoming governor. One of the first significant moves that we made was to get the inventory off the shelves, and with the help of the general and our municipal leaders, we were able to do that. I'm glad to say that Harvard University upgraded Rhode Island's rating vaccine distribution from an F, and they gave us in early February to a B today, and we're going to continue to help improve that grade across any metrics that are out there that we're being measured by. It's good news for people in Rhode Island. They should be encouraged by the progress that our state has made, and I thank Dr. Alexander Scott and the COVID response team who worked with us to speed up this distribution. Today, Rhode Island is approaching the milestone of 500,000 shots in arms, and we've come a long way, and we're committed to keep this momentum going. To give you an idea where we stand right now, Rhode Island has the capacity to administer 100,000 shots per week, and next week we have the capacity to do 160,000 doses per week. This week we received 53,000 doses. That's up from 47,000 last week. That's great news. Dr. Alexander Scott and I were on a call with the White House this week, and we feel as though that the volume and the supply is going to continue to increase, and that's great news. In the meantime, we continue to build out our capacity, ensure that we're ready to get shots in the arms when additional supply arrives. Next, I'd like to provide an update on Rhode Island's vaccine eligibility timeline. Last week, we announced that Rhode Island would open up vaccine eligibility to ages 16 and over starting April 19th, and we remain on track on that date. Over the last week, our team has put together an accelerated eligibility timeline to ensure that vaccination appointments will gradually open up to different age groups ahead of April 19th. And in a moment, Dr. Alexander Scott will provide us with the details. I'm also glad to announce 2 additional state-run vaccination sites that will be opening soon as part of our effort to prepare for an increase in vaccine supply. The site in South County at the Schneider Electric facility will open this Saturday, March 27th at 132 Fairgrounds Roads in West Kingstown, with 400 doses available. And Woonsocket site will open up this Sunday, March 28th at the old Sears building at 1500 Diamond Hill Road with 400 doses available. Appointments for these clinics will go online on Friday at 5 p.m. at vaccinateri.org. As our vaccine supply increases, more appointments will become available at these sites and others. And we're working hard every day to make sure that we can make vaccines more and more accessible to all communities in the state. And where we're falling behind, we will have a plan to catch up with any community that is falling behind. We also have an update on the vaccine pre-registration notification system. Tom McCarthy is going to walk us through some good news on the front. Rhode Islanders will be able to pre-register to be notified when a vaccination appointment becomes available to them. And Tom will give the details on that when he presents. The system will prioritize individuals based on age and underlying health conditions. Next, I'd like to talk about local businesses. Every week, our team sits down and evaluates what we can do to safely give our businesses more flexibility. I'm going to continue to make good on that promise, and that we will make incremental progress on this front as long as the public health data holds and we continue to get increases in supply from the federal government. Today, there are a handful of changes that Secretary Pryor will announce related to self-service seating at restaurants, daily cleaning protocols, and table size events at restaurants. We want to keep the lines of communications open between our team and the small business community. And that was important to me as Lieutenant Governor and continues to be important to me today. Finally, I'd like to highlight some good news related to the child care providers that was shared earlier this week. The Rhode Island Department of Human Services announced that they will be using federal coronavirus relief dollars to provide close to $20 million in support to child care providers starting in April through child care stabilization grants. Licensed child care providers can apply for grants ranging from $3,000 to $50,000 per site, and child care providers can apply at kids.ri.gov. Next, we'll be back with some additional updates on K through 12 and child care, which is being made possible by acceleration of our teachers' vaccination and related staff in both the K through 12 and the child care. So on a personal note, you might have seen, but my wife Susan and I did receive our second shot at the Dunkin' Donut Center on Tuesday. And I want to thank the team at the Dunk and General Callahan, along with the Rhode Island National Guard, who made the process quick and easy. And I met with many people who live in the state of Rhode Island that were just so thankful that how smooth it was. And it didn't hurt. I still got my Band-Aid on my arm, but I'm doing very well. So no one has to be fearful about getting their first or second shot. And I want to make sure that people understand that it's so important that we get vaccinated. And as we work out to build our vaccination capacity and prepare for an increase in supply, we continue to encourage Rhode Islanders to get vaccinated once they are eligible. Final message is we're still in where we need discipline. We need to continue the discipline in terms of the protocols that have kept you safe up to this point in time as you wait for your vaccination. We encourage this strongly, that we continue to have the discipline of wearing masks, social distancing, and limit your interactions with others where possible. It also means getting a shot when you're eligible for a vaccine. And with that, I'd like to turn it over to Dr. Nicole Alexander-Scott to walk us through some of the details. Thank you, Doctor.
Good afternoon, everyone. Before diving into the data, I want to give a quick shout out to the entire data team across our COVID response and at the Rhode Island Department of Health. You can only imagine how much work goes into analyzing and validating data when you're doing more than 20,000 tests a day and the number of 10,000 plus vaccinations a day. Our data and analytics team gets it done every day, and they have since the very beginning. They are the heartbeat of our response, and wanted to take a moment to say thank you. In terms of our numbers for today, we have 110 people currently hospitalized with COVID-19. Our average for the week is 113 people, which is down from 142 the previous week. And it is way down from the more than 500 we saw at points in December. Very thankfully, our fatality numbers also continue to trend in the right direction. We're down 86% from our peak. However, we do sadly have one additional COVID-19 fatality to report today. In terms of cases, we have 441 new cases to report, and that's out of 20,634 tests. That is a percent positivity of 2.1%. This is the sixth straight week that we have been right around that 2% number, 4% positive. A 2% positivity number is good. It's less than half the 5% target that is oftentimes set out, and it's well below the numbers we were seeing just 3 months ago. However, the stability in that number does tell us something about the landscape of COVID-19 in Rhode Island right now. And I want to spend a moment to really explain that and echo what the governor shared about continuing to be disciplined. We are vaccinating more and more people every day, which I will get into more detail in shortly. This means that the pool of people who are susceptible to contracting COVID-19, the coronavirus that causes it, that pool who are susceptible is becoming smaller and smaller every day. However, our percent positive number has continued to stay steady. It has plateaued. It hasn't decreased to the same extent as of yet. What that suggests for us is that there is a significant presence of the more contagious strain of COVID-19 in Rhode Island. I talked last week about the cases of the B117 strain that we have identified. That's the UK strain, as it has been referred to. We estimate that roughly 40% of our cases are variant cases. That's a number that we have projected. Hasn't been surprising, but definitely requires our attention and continued focus on being disciplined. We have a group across our COVID response team and at the Rhode Island Department of Health that's focused on our variant response strategy. We're making sure that it's tailored to the different needs and dynamics that are occurring in different parts of the state. In some places of the state, it looks like expanding access to vaccine and doing everything we can to connect eligible people to treatment is what's going to be key to address the cases that we see there. In other parts of the state, it involves ramping up on our testing efforts in the surrounding communities and doing a full court press with mask distribution, making sure that people have the most upgraded mask that they can wear most effectively. There are different age groups, there are different demographics, all of which we want to continue to monitor and laser in on addressing so that we can continue to stay in front of the variant version of this virus. We are absolutely focused on this, and I share that because I want to make sure that you all continue to remain focused right along with us. As the governor said, we don't want to have to slow down the loosening of our restrictions. And we definitely don't want to interfere with our goal and focus on having an incredible summer here in Rhode Island, the way we are looking forward to. The 3 keys to getting us to that finish line have not changed: testing, treatment, and vaccination. We still have ample amounts of treatment for COVID-19 available in Rhode Island. If you test positive for COVID-19, find out about treatment. See if you're eligible. Talk to your doctor, or if you don't have a doctor, we have doctors who are available for you. Go to covid.ri.gov/treatment or call our info line and ask about getting access to treatment. On testing, please continue to get tested regularly. Make an appointment for a same-day test every week on portal.ri.gov. So it's a normal part of your schedule and a powerful way to continue to protect your household. We're excited that we have a new testing site opening in Woonsocket tomorrow at the Woonsocket Walnut Hill Plaza. This site will be open 7 days a week and will have Binax Now rapid tests as well as the PCR molecular tests for coronavirus. The last thing I want to update on today is our vaccination campaign. As the governor shared, we have made fantastic progress, just as anticipated. We continue to be in the top 5 nationally for the number of people who have received at least one dose, and more than 300,000 people have received at least one dose of vaccine here in Rhode Island. We've administered almost 500,000 doses of vaccine across our state in just these few short months. As you can see on the graph on the screen, our average number of doses administered per day has topped 10,000 doses administered daily. And last week, we administered more than 70,000 doses of vaccine, which is more than we have done in any one week thus far. We are able to ramp up our administration numbers quickly because we have worked hard to build out our infrastructure. We are ready for 100,000 and can even take more in terms of administrations a week. We're excited about the opening of the 2 new vaccination sites that we've shared and have plans to continue expanding capacity based on the assurances we're getting from the federal government about more vaccine coming to Rhode Island. Because we're getting these assurances, we're able to breathe better and feel confident in being more aggressive with our eligibility timeline. As we shared last week, all Rhode Island adults will be eligible to make an appointment to be vaccinated by April 19th. Between now and April 19th, we are going to continue to progressively open eligibility to different age groups, as you can see on the updated timeline now on your screen. We are currently vaccinating people who are 60 to 64 and people who are 16 to 64 with underlying health conditions. The next group to be eligible will be people who are 50 to 59. Our aim is to open eligibility for this group by April 5th. Roughly a week after that, we anticipate opening eligibility to people who are 40 to 49 years of age on April 12th. And then by April 19th, we expect to open eligibility to people who are 16 to 39 years of age. And as you can see, we'll continue vaccinating all those who are above. While not everyone will be able to get an appointment on the first day eligibility opens for their age group, we are confident that most people in each age group will be able to have an appointment within a week or 2 after they become eligible. This is something we consider extremely important and we are really focused on. When I look out over the next several weeks, we really have 3 main tasks before us from a vaccination standpoint. The first is to continue expanding our capacity so we're able to administer vaccine as quickly as it comes into Rhode Island. We're doing a great job on that front, and I'm proud of all the work that the team has put in to get us to such a strong place, and we're going to continue pushing forward from there. The second task is to narrow our disparities and to continue to be laser focused on addressing that directly. We want to make sure that our vaccination rates are as high as possible in all communities throughout the state, particularly in communities where we know the case rate and hospitalization rates have been higher. Vaccination rates need to at least mirror that or be beyond. That includes especially a focus on our communities of color. We know from our data that our communities of color have been hit hardest by COVID-19. We've also understood that it's based on the surrounding environments, the determinants of health, the employment, the access, all of the dynamics that we know contribute to why certain communities are disproportionately impacted compared to others. That's why it's so critical for us to make sure that we're front and center in addressing it. The thing we are keen on is hospitalizations, as I've mentioned. We want to hold ourselves accountable to getting our vaccination rates as high as possible in our communities where we have seen the greatest number of hospitalizations. We have been receiving some very valuable input from our leaders in the Governor's Equity Council, and we are going to keep engaging with them and responding to them and gaining from them their insight on how we can and will do better. We've done a lot of great work with a lot of very dedicated community partners thus far, and we also know that we have much more to do. We are committed to that together. Finally, we're working to make the registration process as customer-friendly and convenient as possible. This approach is unlike anything we've ever done before. We've never taken on a mass vaccination campaign with the demand so high and supply so limited up front, and then know that it's dynamic and be able to respond effectively. But we are committed to doing whatever it takes to help ensure that everyone who wants to get vaccinated can and will get vaccinated here in Rhode Island. We know that some people have had a frustrating experience trying to get an appointment and not being able to get one. We're making a change to address that and any other improvements we can make to make the customer service experience as streamlined as possible. We know that this is important, we're focused on it, and we're excited about the progress we're making across the board. I want to hand it over now to Tom McCarthy so we can go into some more details about some of these customer service experience improvements we're looking to make.
So good afternoon, everyone. I'm going to give a logistics and operations update following up on the overview offered by Dr. Alexander Scott. As the director shared, we have a lot of great momentum going in our vaccination campaign. Last week, we administered about 73,000 doses of vaccine, which is an increase of more than 12,000 doses over our previous one-week high. As I said last week, we have the capacity to do much more. We have the capacity to administer 100,000 doses a week now, and by next week, that'll be in excess of 165,000 doses per week. The reason we're building out this capacity is because, as the director indicated, we're being told to expect much more vaccine in the coming weeks and months. We're very excited about opening the 2 new state-run vaccination sites that the governor described. As the governor shared, our South County site at the Schneider Electric facility will open this Saturday and will operate from 2 p.m. to 6 p.m. The Woonsocket site will be open on Sunday, and that will be operating from 2 p.m. to 6 p.m. as well. Appointments for these sites will be posted tomorrow afternoon at our normal 5 p.m. time, and there'll be about 400 slots for each site posted tomorrow. In addition to these sites, we are working to open locations in Westerly, East Providence, and Johnston in partnership with the leadership in those communities, as I shared last week. Appointments for these 3 sites will also be available through vaccinateri.org. We've made a lot of improvements to the registration site since we started doing age-based vaccinating in mid-February, and we're continuing to make adjustments. One limitation right now is that people have to go in and check to see if an appointment is available. Some people have been able to get an appointment on the first try. Others have had to go back repeatedly in order to get an appointment. To address that, and to make the system more customer-focused and customer-friendly, we are building a pre-registration system using our existing vaccine interest notification list, as Dr. Alexander Scott shared. This is the list that people can join through portal.ri.gov. After you submit your information to the vaccine interest notification list through portal.ri.gov, we will send you a notification when an appointment is available for you. This appointment will be for a given day at a given site. We envision starting to send out notifications the week of April 4th, well ahead of expanding eligibility to those 16 plus. People who don't submit their information into this pre-registration system will still be able to make an appointment like you can now by going directly to vaccinateri.org or by registering for vaccination at another site, such as our pharmacy partners. I want to be clear that this pre-registration system is simply one more option for people. It is not required. Starting April 7th, roughly 50% of the appointments at the mass vaccination sites will go to people who have pre-registered. When you submit information for the vaccine interest notification list, you'll also be able to tell us about how you prefer to be contacted with information about the appointment available to you. You can choose email, text message, or a phone call. When a slot opens up for you, we will contact you using your preferred method. You'll be contacted about a slot roughly 2 weeks in the future, and we'll be sending out notifications about appointments each Wednesday starting April 7th. I know that people have a lot of questions about the system, so I'm going to try to get ahead of those with a few points of additional detail. So if you're not able to sign up for the vaccine interest notification list online, you can do so over the phone. That phone number is 844-930-1779. We're going to hold our vaccine interest notification list up against our list of people who have already been vaccinated or who have an appointment. Those people will be removed from the vaccine interest notification list, meaning that they won't be contacted about an appointment because they've either already been vaccinated or are currently scheduled to be. The appointment that will be offered to you will be for a specific site on a specific day. You'll have some flexibility on the time, but the appointment will be for a set date and location, which will be one of our 5 state-run sites: the Dunkin' Donuts Center, Socknaset Crossroad, Middletown, South County, or Woonsocket. Some people may not be sure if they've already signed up for the vaccine interest notification list. We're going to send an email or a text message to you each Wednesday, even if an appointment is not available to you yet, so that you can be confident that you're in the system and you'll be taken care of. As Dr. Alexander Scott shared, we're going to be opening enrollment to new age groups progressively over the next few weeks. However, everyone can register for the vaccine interest notification list now, and you can expect an appointment after your age group is eligible. The link you get to register is a link for one-time use. We've had some issues with link sharing in the past. These links we'll be sending out can only be used once, so we don't think that will be an issue moving forward. When signing up for the vaccine interest notification list, people provide their age and other information, such as information about any health conditions. That information will help determine the order in which people will be vaccinated within the different eligibility groups. This is a way for us to ensure that we continue to get at the people who are most at risk in Rhode Island. For people who want to sign up for the vaccine interest notification list, I'll share the website and phone number one more time: portal.ri.gov, and the phone number is 844-930-1779. I said that we are going to start with roughly 50% of our appointments at the state-run vaccination sites being available through the pre-registration system. We're going to monitor the response and continue to adjust the vaccine to the pre-registration system if we're seeing more demand there, learning every week. However, this is just one option. If you prefer to not pre-register, you can still go on to make an appointment through vaccinateri.org or through one of our pharmacy partners. I want to wrap up by saying that we will be able to vaccinate every single Rhode Islander that wants one, and I hope you all want one. No one will be left behind, and no one will be forgotten. This pre-registration system is a great step in the right direction toward ensuring that we get a shot in the arm of everyone in Rhode Island that wants one. With that, I'll turn it over to Secretary Pryor.
Governor McKee, Dr. Alexander Scott, Mr. McCarthy, thank you very much. Pleased to be back with you all today to talk about loosening restrictions for our businesses. Though we are not making sweeping changes today, we are pleased to be proceeding with the kinds of modest changes that make a big difference to small businesses. So I'm going to express the changes that we are prepared to implement this coming Friday, tomorrow. The governor touched upon them in his remarks. We want to thank the Ocean State Coalition, the Hospitality Association, and the Small Business Coalition for their continued input on these processes. They've been invaluable to us. So here are the changes. First, relating to restaurants and catered events, we're pleased to increase the outdoor table number of seats permitted from 8 to 10. We've placed an emphasis on taking it outside, on outdoor dining and outdoor activities in general. We think it is sensible to increase the number of people who can be in a party at a table. We've heard specifically from catered event professionals that it's especially challenging to have smaller table sizes, so we're pleased to progress to 10 starting tomorrow. We're also pleased to allow flexibility for restaurants and for food courts related to self-service seating. To date, we've not permitted self-service seating. We recognize that business owners and customers understand the requirements. They understand keeping 6 feet distance. They understand cleaning between parties, between seatings. And we know that we can trust in the establishments and the individuals to undertake those activities. So starting tomorrow, self-service seating will be allowed so long as those protocols are followed, including, for example, cleaning between individuals sitting at those tables. And we know that this change is important, especially as the warmer weather allows for ice cream shops and allows for other summer establishments to open and reopen. So we're grateful for this change. Starting tomorrow, we're also going to be allowing gyms and fitness centers to more fully reopen their shower facilities. There have been some restrictions upon showers that have limited some gyms and fitness centers, and we are going to make those changes. And finally, we've been going through our rules to look for those outmoded and unnecessary rules that might have made more sense as a structure or as a signal earlier in the pandemic. And we're aiming to systematically remove those that we just don't need anymore. One of those examples is the requirement of a cleaning log. To date, every business has been required to keep a log of where and when they're conducting their cleaning in accordance with our public health protocols. We've heard from many businesses that the paperwork is just taking time that they could otherwise invest, quite frankly, in doing the cleaning, in maintaining their business, in staying open, in finding new customers. So we recognize that we need to remove some of these requirements, especially given the evolving science around things like the cleaning of surfaces. So we do want to ensure that especially frequently touched surfaces continue to be cleaned, that there be an overall facility cleaning in accordance with the protocols, but we are eliminating the paperwork requirement that many businesses have found to be a nuisance and to get in their way. So we know that those are small changes in the scheme of things, but for the individual businesses involved, they are meaningful, and we're grateful to Governor McKee for continuing to create a process by which we can undertake these changes. And you'll see that in future weeks, in addition to structural changes, we're going to root out some of those outmoded and unnecessary rules going forward. So with that said, we'll open it up for questions.
Okay. A significant element of the rationalization behind the issuance of the executive order was the inability of the Rhode Island General Assembly to convene, given what appeared to be significant public health issues of meeting in person. Currently, the Assembly is in full session. They're actively engaged in a full range of legislative activities, including consideration of gun control, climate change, and the need for doulas and birth coaches. As the executive order clearly usurps representative government, why is the executive order still in place?
Because we're still challenged with a virus that we need to get on top of. So let's get everybody vaccinated. The more people get vaccinated, the more possibilities we are to have loosen up not only the businesses, but also on the executive order. And we're not even halfway there yet.
This is not a monarchy per se. I'm not accusing you of that. A lot of this is based on your predecessor, but ultimately, doesn't the General Assembly have a critical role in determining the actions in response to this now that they are in fact meeting?
Yeah, and I'm meeting with them, with the Speaker, the Senate President, and other leadership, not only on the budget, but other related areas. So that process is continuing and the people are being well represented.
There's no formal review process per se, if in fact an executive order eliminates the need for legislative approval. And this is going to be critical, for example, when you've got the presence of possibly $1 billion, $2 billion, $10 billion, whatever, from President Biden's relief program.
I've answered that as well. We'll be working with the General Assembly on all those issues.
Doctor, we talk about micromanaging. This is a lot of folks have evidenced a lot of frustration with this. For example, the change from 8 people to 10 people at a table. Now, in a state where, for example, we don't seem to have an agreed upon CTR cycle time threshold value in terms of arranging or arriving at our 2% infection rate, at a time when every established clinical trial has denied and disproven the efficacy of using masks. I think there's, what, a dozen trials been out there, randomized trials, thousands of people involved. How do we arrive at these seemingly, how many angels on the needle of a pin measurements do we get going from 8 to 10 specifically? That has significant impact going forward on business.
We understand the science behind the virus and how the virus spreads. When you have larger groups of people together in close quarters, unmasked, engaging closely, perhaps in less well-ventilated areas, and with a variant that is continuing to spread, the risk for transmission is higher. Every step we can take to mitigate against that, to minimize the risk of that type of invisible or otherwise spread, is valuable to do. And the incremental steps that we have been taking to help release that are to make sure that we do it carefully. As I've shared, we are in a plateau. We are not still continuing to decline. That means the variant is still present, it is spreading, and we need to continue to be cautious in how we're proceeding.
Respectfully, at a point in time when Rhode Islanders were surveyed and there was an acknowledged near 96% use of masks, and I'm just using this as one example, I don't want to assess over masks per se, we had one of our biggest spikes. Despite continuing restrictions, we seem to have the worst of all worlds here.
Masks are effective. We can go to the next question, Brian.
How far along or how much of the current eligibility age group has been vaccinated, the 60 to 64-year-olds, the people with underlying health conditions? I know that was obviously a big group and a reason that the system got bogged down. How far along is that, and how confident are you that you're going to be far enough along when you open up that next eligibility group in a week and a half that it's not just going to overwhelm the system again?
Yeah, at this stage, we've vaccinated about 45% of that next eligibility group. So we remain on track to open up to the next groups here in the coming weeks.
And we have baked out the numbers and the timeline based on an estimate of reaching about 70% vaccinated. So we're being very aggressive with that. And that is how we determine reaching that mark, knowing that we have achieved that with the previous age groups, is when it's an acceptable time to move forward.
Given the changes to the registration system and the vaccine supply, would you still warn people that it could still take a while to get an appointment in that group on April 5th, or do you expect that to go significantly smoother?
We are always expecting it to go significantly smoother. That's what we're working 24/7 to allow to happen. As I have shared, we have relayed that within 1 to 2 weeks of your eligibility opening, you should be able to access a vaccine. With the increasing supply and the improvement in the experience, that should get better, but that's our baseline for right now.
One more. Providence, most of Providence and all of Pawtucket opened up eligibility earlier this week to all adults 18 plus. What are you seeing there in terms of hesitancy or people's willingness or lack of willingness to get the vaccine? And is the demand not there, or what are you seeing? Because in just talking to people in the community, there's surprisingly a lot of people who say, I'm not going to get it.
So what you just described is part of our high density community strategy, which is also focusing on individuals, people of color who make up a large proportion of some of those communities. And our model is what occurred in Central Falls. We had our weekly conversation with our Central Falls mayor and her team today, and really showed when access is addressed, the rates for people 60 and older, 75 and older can even surpass what you're seeing in other parts of the state. So our focus has been first and foremost on access, doing what we need to make sure that whether or not you have a computer, whether or not you have a car, whether or not you are working a job that gives you the time frame to get vaccinated, you will have the ability to access vaccine. Our second major focus is building vaccine confidence. We want to make sure that everyone has the information that they need to be able to get vaccinated. We've seen by and large here and nationally, when you focus on those two items, you do get the type of response. We've had 70% plus response rates in our higher age groups, and we're going to keep doing everything we can to push on that demand, particularly as the supply is coming in.
Let's go Anita, then Steve, and Amanda.
I have a couple questions. First, there was a group of minority community leaders at the State House steps this morning. They say more needs to be done for the communities of color. DOH data shows 19% of vaccines have gone to people of color, even though they make up a third of the state. Do you think more needs to be done to fix this sector?
Absolutely. We are very much aligned with what the community leaders have called out. Many of them are part of the Equity Council that I talked about before, who have been valued partners with us, holding us accountable, providing proposals on how we can make improvements. We have done a lot. There's more that needs to be done. And it does require this all hands on deck, as well as creativity and intentionality to help address the numbers that we're seeing right now.
I have a couple little minor questions. We were told that it would be a waiting room function that would open up on the website. Does this pre-registration system replace that, or is a waiting room function also in the works?
Yeah, we've made several enhancements to the website over the last few weeks. So we've deprioritized the waiting room. We no longer believe that it's a function that we'll need in order to handle the traffic, and then especially as we get the pre-registration system online. So it's still there if we need it, but we think we've solved for it in a better manner.
Lastly, the mass vaccination sites in Woonsocket and South Kingstown, you said they will operate 2 to 6, I believe. Is that all like throughout the week? Because that's significantly shorter than the rest. And the other sites were Westerly, Johnston, East Providence. When will those mass vaccination sites open? When do you expect?
The regional municipal sites, so Johnston, East Providence, and Westerly, that should be in the beginning of April here, the next week or two, all dependent upon supply. The local municipalities are ready to go. As far as South County and Woonsocket, we're going to begin with 1 day a week, 2 to 6 p.m., but they're ready to expand to 5-6 days of operation as soon as we get additional supply in the state.
The other 3 aren't mass sites, though. They're just regional to be Westerly, Johnston, East Providence, or are they mass vaccination clinics?
They are vaccination sites. The scale will be a little bit different, and their days of operation, we're looking at a minimum of 2 per week once we get fully up and running. But those are led by collaboration of local municipalities.
Mr. McCarthy, you outlined how your expectation that the state is going to receive some additional vaccine next week. What do you base that on? And do you have any assurance that that's going to increase in the coming weeks?
No, we do. So we've started to see some of the increases actually manifest themselves in our ordering process and system. So it's becoming concrete. And then we received reassurance from the federal government just yesterday that it's going to continue to expand. So we remain on track for what we've been forecasting and expanding eligibility.
Could you provide an update on homebound Rhode Islanders? How is that vaccination process going?
Yeah, so right now we have about 2,000 Rhode Islanders that are on the list of homebound, and we began vaccinating them last week, and we've already vaccinated about 15% of them.
Dr. Alexander Scott, good afternoon. What percentage of teachers have been vaccinated in the state of Rhode Island?
We are at about the 80% mark for teachers. We are continuing to build vaccine confidence by making sure that people are informed and educated. 80% is a very good number, so we don't usually associate hesitancy with that, but it's always important that everyone has access and confidence in going ahead and getting vaccinated.
Have been offered the chance to have it, right?
Absolutely, yeah.
On the testing as it relates to percent positive, because I had this conversation with somebody last week. I would assume the numbers, and you can tell us, the numbers of tests every day compared to 2 or 3 months ago when we were really in the height of it and you were pushing asymptomatic testing, those numbers have gone down, right? In terms of the daily tests that we're administering or not?
No, it's actually something that we are quite pleased with. You are seeing the decrease in other states, but the energy that we have put into maintaining the demand for testing, really encouraging everyone here to every week get tested, has allowed us to hold steady with the number of tests. To be able to say today that we tested 20,000 people yesterday, which is similar to tests that we were doing weeks and months ago, is a true credit to all Rhode Islanders as well as to our team that has worked comprehensively and with Governor McKee to ensure that everyone who wants to get tested takes advantage of our state-of-the-art nation-leading system.
Right, and you're continuing to encourage that.
Asymptomatic, absolutely. Whether or not you have symptoms, get tested. It's a way to protect your household. It's a way to identify, particularly with the variant here. We want to make sure people know testing, treatment, and vaccination are critical to getting us through this.
Doctor, good afternoon. You mentioned that we're seeing a significant onset of the variants here in Rhode Island. Can you sort of humanize for people the real danger of this? We're seeing this double mutation coming out in India. There's a lot of media hype on a national scale about the danger of the variants. Can you just sort of humanize exactly what this means for people if they continue to adhere to protocols, what the likely outcome is?
Absolutely. I shared earlier that we have a variant response strategy team that's focused on this overall. A key is messaging and to help the public understand that variants are out there. Those mutations can normally occur. When they become variants of concern is when we see increased transmissibility. The variants are more contagious, 50% or more contagious than what they previously were. What we have provided to you all, though, are tools to help us get through this in spite of it. Testing regularly is a powerful tool that everyone in Rhode Island has access to. We lead the nation in doing this. We want everyone to take advantage of it because it helps you identify and then be able to behave differently once you know if you've been exposed to COVID-19, particularly one of the new variants. Getting treated keeps you out of the hospital if you qualify. Getting vaccinated, we're in the top 5. We're going to continue to push and continue to ensure that our communities of color and everyone who needs access gets access to the vaccine. We've talked significantly about upgrading your mask, making sure that you're wearing them effectively, using the right ones, the KN95 or others. Masks work. They work, and they are extremely effective against the variant or any other form of coronavirus. Being aware of timing, limiting how long you're in a particular place, especially if the ventilation is poor, and making sure that you can expose yourself only to places that have great ventilation. Windows open, take advantage of our beautiful weather, go outside, take it outside. These are all strategies that we all have at our fingertips that will help us get through the fact that those variants are there.
I think this would be a question for Governor McKee. As you ease restrictions on outdoor dining, loosen restrictions on showers and gyms, and people get more vaccinations, do you foresee maybe loosening state restrictions on out-of-state travelers? And if so, is there a target date for that?
No target date, but as I mentioned last week, there'll be music in Newport and this summer, and that was done to let people know that we want to be open for business this summer. So We'll certainly will take into consideration what's happening in the other states, and hopefully they're keeping pace with us on vaccination and other things that we're doing. And if they are, we're going to be welcomed into the state of Rhode Island.
Governor McKee, last week was Sunshine Week. I'm wondering, as we approach the end of the pandemic, the predecessor was towards the end, not accessible to the press. I was wondering what your administration was considering going forward after COVID is over, that glorious day, if you consider continuing doing weekly press conferences and being available to the press.
Yeah, so we're going to continue. We've been available to the press. We've talked to many media outlets on non-COVID issues as well as COVID issues, and I would hope that we would be able to have a weekly discussion about non-COVID issues even before COVID is over.
Yep, Governor, Blue Cross Blue Shield of Rhode Island just rolled back their policy on stopping the full coverage of COVID-19 after you and Commissioner Teague had conversations with them. Can you just kind of outline to me what you and the Commissioner said to make them roll back and go back to fully covering COVID-19 treatment?
Well, I think the message was I said last week, and both Director Teague was doing as well. First of all, I had a meeting with both Jim Vincent and Pastor Jenkins after that press conference today, and they were concerned about that messaging that that communities thought that their vaccine was potentially going to cost them if Blue Cross or any of our health insurers reversed their position right now. So we want to make it very clear that the vaccine, there is no cost for that. And I would just say that they made the right decision. I think they reflected. They probably got ahead of themselves, and they made the right decision. And I'm happy that they are. As I mentioned, they've been a great partner for us during the pandemic.
Follow up to that as well. Both them and Neighborhood Health Plan of Rhode Island said that they would continue to fully cover COVID-19 treatment as long as there's a state of emergency. Does that influence you keeping the state of emergency, extending it, or ending it at any point?
There's multiple factors on the state of emergency, right? In terms of making sure that there's a financial issue that we want to make sure that we're following to make sure that the state is getting reimbursed for its expenses, as well as the health insurance, as well as the education, as well as having open government. So those all have to be factored in. And at the moment, as I said, we're not there yet. It's too premature to say mission accomplished at this point in time.
Secretary Pryor, Massachusetts has lifted their capacity limits on restaurants. They're at 100%. Any plans for Rhode Island to be at that point sometime soon?
We're pleased that we've been able to lift all the way up to 75% capacity, and we've also recently moved the table spacing from 8 feet to 6 feet. Also, we have bars open under restricted conditions, which are more extensive than what's available in Massachusetts. Having said all of that, yes, we're continuing to evaluate the public health conditions in close consultation with Dr. Alexander Scott and RIDOH. And we look forward to a day when we can be at 100% capacity in the restaurant category, very important, and in other categories. Having said that, you heard the doctor, and I think we all need to pay attention to these points. The variant seems to be spreading substantially in the region. And even with vaccinations accelerating, we're seeing stability in our infection rate, in our positivity rate, but not a decrease at the moment. What we want to make sure of is we make those changes that are possible as rapidly as possible, while not creating instability in our public health conditions so that we have to in any way think about further restrictions. So that's the balance. Again, having said all of that, we do look forward to a day when we can be at 100% capacity, and we're monitoring very closely to see when that can be.
Is there a specific variant that you're looking at? I don't know if it's just the UK variant or some of the other ones that you're worried about. Does the vaccine protect against all of them?
B117 variant is what I'm referring to as being present here in Rhode Island, which is analogous to the UK variant. That's what has been identified. But we know that there are other variants that are present. As far as we know, the vaccines, by and large, cover the variants. The effectiveness may change a little bit, but it still achieves the goal of keeping people out of the hospital and keeping them alive. It's also, though, why it's important to emphasize, in addition to vaccines, continue to get tested, continue to get treatment, wear the best upgraded mask most effectively that you can, and get outside. Let's enjoy some of this weather.
Significant climate bill on another note. Sorry. Oh, thanks, Jim.
Either way, where are we? Where is the Department of Health on spectators for both high school and college sports? And looking down the, a lot of parents are listening to this who kind of got robbed of watching their kids during winter sports. Outside, things are getting better. And, it's kind of like we saw the nursing home hesitancy. The Department of Health said you can do this, but they necessarily didn't. Some superintendents may be listening to this. What is your message to them and by extension, the parents?
And for college or for
Both.
K through 12? At the college level, we have supported the collegiate authorities in the best way to approach it. For K through 12, we have in partnership with the Interscholastic League, who has been amazing with us through this. And I also want to thank Director Coit, Janet Coit, and her team that have been phenomenal in engaging our partners so that we have the types of outcomes that we need to have. Spectators have been allowed in limited numbers in those specific situations, and we can get to you the details of where we are offline.
What do you foresee for graduations, high school graduations?
We're still working through that. We intend to have it align with where we are with venues of assembly currently, but want to continue to work with our education partners on determining what will be the best approach.
Governor, on another note, a significant climate bill passed the General Assembly. What are your thoughts on that? Are you going to sign it? I know Republicans were concerned about a potential cost to homeowners.
Yeah, so we're reviewing those very issues on both sides of the argument, but look, this renewables is going to accelerate at a very high rate, and we all got to realize that, that's going to happen. So we'll be reviewing that, and once we receive it from the General Assembly, we have not received that yet. I would imagine the first week of April we'll have that.
Mr. McCarthy, Attorney General in Rhode Island recently opined that it was inappropriate for board members of Lifespan and Care New England to receive vaccines. Do you share that view?
I mean, my focus is on vaccinating those eligible Rhode Islanders as quickly as we can. So hasn't been something that I've been able to spend too much time on.
Following up, do you think the Rhode Island Department of Health should have had stronger policies in place? Because the Attorney General said that was one of the reasons why they were able to get those vaccinations ahead.
Yeah, it's appreciated. The first portion of our vaccination campaign, as everyone understood, and we saw the tremendous outcomes from that, was to keep people out of the hospital and to keep them alive. A part of that was making sure that hospitals maintain the capacity that they needed and could use the vaccines to preserve their hospital system. There's a large variety of individuals in a hospital that are critical to keeping a hospital system functioning. So we instructed the hospitals to go ahead and vaccinate those individuals that they felt would be critical to keep hospitals functioning. We did not envision that board members were a part of that group. Once we did learn of that, we asked the hospitals to redirect their vaccines to those who were outpatient providers, because the hospitals have been great partners in helping to get other communities vaccinated. And the Attorney General's input on specificity is definitely helpful, and it's certainly something we would take into consideration for the future if we were to have a similar situation.
Governor McKee, last week you committed to a 70% vaccination rate as a benchmark, if you will, to completely reopen the economy. Two questions. Number one, how close are we to that? And number two, what are you measuring 70% of?
Well, first, I didn't say completely, but the 70%, we're, as Dr. Alexander Scott and others have reported, we're over 300,000 first shots. And we're looking at moving up to about the 620,000, 650,000 mark by, I think, sometime between, on first shots, sometime between mid-May and the end of May. So when we get to that level, we'll see where we are on all the other factors. But that's a key point for me on that issue. And I do want to just say, follow up on the press conference that was at the State House today. I did meet with both Jim Vincent and Pastor Jenkins on the issues, and there is an issue there. And wherever there's an issue, we need to really address. If, for instance, the Black community is at 3% of the shots, and they're at 8% of the 8% of the population, we got to ratchet that up. I think everybody would understand that. So, just as an example, if we did 300,000 shots, and they're 8% of the population, that population we should be closer to 24,000 shots with them, right? Being fair across the board. If we're at 10,000 shots, we've got some makeup to do. So that's the idea, to kind of put it into a math formula and make that happen. So.
Question of kind of line jumping with this current eligibility group of people with underlying health conditions where you don't have to show any proof. Have you heard either anecdotally or have any evidence of people cutting the line, faking that they have that? I know people are concerned that people are jumping in when they really shouldn't.
I think what we've seen so far is that Rhode Islanders have generally continued to do the right thing. You know, we continue to check and put quality control measures in place, but we've had to cancel very few appointments because people were ineligible. Most of the issues have been tied to sharing links or QR codes for second doses, but generally we've been in good shape there.